There is something happening inside your body right now, at this very moment, that you cannot feel, cannot see, and most likely have never been warned about. And the terrifying part, it may have already been going on for years. I know that sounds alarming. I know you might be tempted to brush that off, but I need you to stay with me because what I am about to walk you through in the next few minutes is information that most people never receive until it is far too late to make a real difference. I have spent the last 23 years working as a kidney specialist. I have sat across from thousands of patients in my examination room and delivered news that changed their lives in an instant. News they were completely unprepared for. News that could have been prevented if only someone had reached them sooner. That is the reason I am here. That is why I keep making these videos. Because the gap between what medical professionals know and what ordinary people know is costing lives every single day, and I refuse to be silent about it. Today, I want to talk to you about a substance that is silently eroding your kidney function with every single passing day. A toxin that does not come in a labeled bottle with a skull and crossbones on it. It does not come with a warning from your pharmacist. It does not trigger any alarms when you consume it. In fact, most people consider it completely normal, even comforting. They give it to their children. They start every morning with it. They unwind with it in the evenings. And it is destroying one of the most vital, irreplaceable filtering systems in the human body. Before I tell you exactly what it is, I want to make sure you understand something critical about how kidney disease actually works, because this context is going to make everything else I say land with the weight it deserves. The silent progression that catches everyone off guard. Your kidneys are extraordinary organs. Each one is roughly the size of your closed fist, and together they perform a staggering amount of biological work every single day. They filter somewhere between 120 and 150 quarts of blood per day. Think about that number for a moment. That is not a typo. Every 24 hours, your two small kidney organs process that volume of blood, removing waste products, regulating your fluid balance, maintaining your blood pressure, controlling electrolyte levels, stimulating the production of red blood cells, and activating the form of vitamin D your bones depend on for strength and density. These are not optional functions. These are the systems that keep you alive and functional every moment of every day. And your kidneys perform all of this without rest, without complaint, and almost entirely without your awareness. Here is the thing that changes everything once you truly understand it. Your kidneys have a hidden reserve capacity that is both their greatest strength and their most dangerous vulnerability. Because of the way they are designed, they can lose up to 65 or even 70% of their filtering capacity before you feel a single noticeable symptom. Let me be very clear about what that means in practical terms. By the time you experience swollen ankles, unusual fatigue, changes in your urine output or color, brain fog, nausea, or any of the other warning signs of kidney disease, you may have already lost more than 2/3 of your kidney function. And in many cases, damage at that level is not reversible. It is not something you correct with a medication or a dietary shift. It becomes a permanent condition that defines the rest of your life. This is the architecture of the crisis. Not a sudden dramatic event, but a slow, invisible, silent erosion that happens over months, years, and sometimes decades. And all the while, you feel essentially fine. You go to work, you raise your family, you laugh, you sleep, you eat the foods you have always eaten, and your kidneys are quietly losing ground. That is why I need you to keep watching this. That is why this information matters so much right now, while there is still time to act. What is the toxin? The answer that surprises everyone. The substance I am referring to is processed, refined, and added sugar, specifically the avalanche of hidden concentrated sugar that has been systematically embedded into the modern food supply over the past several decades in amounts that have no historical precedent in human nutrition. Now, I can already hear some of you thinking, sugar again? I have heard this before. And I understand that reaction completely. Sugar has been discussed so frequently that it has become background noise for many people. But I want to challenge you to set aside everything you think you know and hear what I'm about to say with fresh ears. Because the mechanism by which sugar destroys kidney function is something most people have never been fully explained. And once you understand the biological chain of events, your relationship with this substance is going to change permanently. We are not talking about the natural sugars found in whole fruits and vegetables. We are not talking about an occasional dessert or a birthday cake once a year. We are talking about the massive, chronic, daily overconsumption of added sugars that has become normalized across the modern world. We are talking about the sugar in your morning-flavored coffee drink, in the yogurt you thought was healthy, in the bread you had with lunch, in the salad dressing, in the protein bar, in the pasta sauce from a jar, in the bottled iced tea, in the sports drink, in the ketchup, in the breakfast cereal. The list goes on, and most people are genuinely shocked when they add up how much added sugar they are actually consuming each day. The American Heart Association recommends a maximum of 25 grams of added sugar per day for women and 36 grams for men. Current research suggests that the average adult in developed countries is consuming between 80 and 100 grams of added sugar daily. Many are consuming significantly more. That is 3 to 4 times the safe upper limit every single day without interruption, year after year. And the kidneys are paying for it in ways that most people will not discover until the damage is already catastrophic. The biological chain reaction inside your body. Let me walk you through exactly what happens biologically when you chronically overconsume sugar. I want you to visualize this process because understanding the mechanism is what transforms information into motivation. When you consume a meal or a beverage that is high in refined sugar, your blood glucose levels spike rapidly. Your pancreas, detecting this surge, releases a large amount of insulin into your bloodstream. Insulin is the hormone that acts like a key, unlocking your cells so they can absorb glucose and use it for energy. Under normal circumstances, this system works beautifully. A little sugar, insulin rises, cells absorb glucose, levels normalize, and the process resets. But when you flood this system repeatedly, day after day, with far more sugar than it was ever designed to handle, something begins to change at the cellular level. Your cells start to become desensitized to insulin. They stop responding to it properly. The keys no longer fit the locks quite right. So your pancreas compensates by producing even more insulin. And for a while this works. Blood sugar levels stay relatively controlled, but the underlying dysfunction is worsening beneath the surface. This state is called insulin resistance, and it is the critical gateway to type 2 diabetes. And it is at this point, long before an official diabetes diagnosis is ever made, that your kidneys begin to suffer real damage. Here is how. Your kidneys are among the most vascular organs in your entire body. They are essentially an enormous, intricate network of tiny, delicate blood vessels. The most important of these are the microscopic filtering units called glomeruli. There are approximately 1 million of these in each kidney, and they are the actual workhorses of filtration, pulling waste and excess fluid out of your blood with extraordinary precision. When your blood sugar levels remain chronically elevated, those high glucose concentrations begin to damage the walls of these tiny blood vessels. The vessel walls thicken and harden. The glomeruli become inflamed and progressively scarred. Over time, their ability to filter blood accurately begins to deteriorate. Some of them stop functioning entirely and are replaced by scar tissue. And here's the critical point. Those glomeruli do not regenerate. Once they scar over, they are gone permanently. This progressive deterioration is the clinical condition known as diabetic nephropathy, and it is the single leading cause of kidney failure in the developed world. Not a rare genetic disorder, not an unusual autoimmune condition. The leading cause of kidney failure is damage driven by blood sugar dysregulation, which is driven by chronic excess sugar consumption. You do not have to be diabetic for this to be happening to you. This is the part of the conversation that I find most people are truly unprepared for. There is a widespread assumption that kidney damage from sugar only becomes a concern once someone has an official diabetes diagnosis. That assumption is dangerously wrong. Research has consistently demonstrated that kidney damage begins accumulating during the pre-diabetic phase, when blood sugar levels are chronically elevated but have not yet crossed the threshold that triggers a clinical diabetes diagnosis. There are tens of millions of people who fall into this category right now. Many of them have had blood work done relatively recently, been told their numbers are not quite at the diabetes threshold, and left the doctor's office feeling reassured. But chronically elevated blood sugar in the pre-diabetic range is already driving inflammation, already damaging glomeruli, already initiating the scarring process that leads to chronic kidney disease. By the time the official diagnosis of diabetes arrives, kidney damage is frequently already well underway. And beyond the blood sugar pathway, excess sugar creates another category of damage through compounds called advanced glycation end products, or AGEs. When excess sugar circulates in the bloodstream, it binds to proteins and fats in a chemical reaction that produces these harmful compounds. AGEs accumulate in tissues throughout the body and cause sustained oxidative stress and inflammation. Because the kidneys are so richly supplied with blood vessels, they are especially vulnerable to AGE accumulation. The inflammation they trigger accelerates the scarring process in the glomeruli and speeds up the progression toward chronic kidney failure. The worst offender, high fructose corn syrup. Among all the different forms of added sugar currently embedded in the food supply, there is one that I consider particularly dangerous for kidney health, and that is high fructose corn syrup. High fructose corn syrup is found in an extraordinary range of products: sodas, energy drinks, fruit-flavored beverages, condiments, breakfast cereals, snack foods, sweetened dairy products, fast food items, and many packaged foods that people would never assume contain significant sugar. Its prevalence in the food supply is the result of decades of industrial food processing decisions driven by cost and shelf stability, and it has had profound consequences for public health. The reason high fructose corn syrup is particularly damaging is that fructose is metabolized fundamentally differently from glucose. While glucose can be utilized as energy by virtually every cell in the body, fructose is processed almost exclusively in the liver. When fructose arrives at the liver in the large quantities typical of regular high fructose corn syrup consumption, the liver becomes overwhelmed. Unable to process it efficiently, the liver converts the excess fructose into fat. This leads to the progressive accumulation of fat in liver cells, a condition called non-alcoholic fatty liver disease, which itself generates systemic inflammation that ripples out to damage other organs, including the kidneys. But there is a second mechanism that makes high fructose corn syrup especially destructive to kidney tissue specifically. When fructose is metabolized in excessive quantities, one of the byproducts produced is uric acid. Elevated blood levels of uric acid are something most people associate exclusively with gout, the painful joint condition that results from uric acid crystal deposits. But uric acid elevation does much more than cause joint pain. Chronically elevated uric acid causes direct damage to the blood vessels of the kidneys. It impairs blood flow through renal tissue, promotes sustained inflammation, and accelerates the formation of exactly the kind of fibrous scar tissue that replaces functioning kidney cells permanently. Multiple large-scale studies following thousands of participants over years have documented that people who regularly consume 2 or more sugar-sweetened beverages per day face a substantially elevated risk of developing chronic kidney disease compared to those who rarely consume them. 2 drinks, one with lunch, one in the evening, something that describes a normal day for a significant portion of the population. A story that represents what I see every week. I want to share a composite picture of the kind of patient I encounter regularly in my practice, because I think it will resonate with many of you watching this. Imagine a man in his mid-40s. He is not obese. He exercises occasionally. He does not consider himself someone who eats poorly. He does not stop at fast food restaurants regularly. He does not eat dessert with every meal. He comes to see me for a routine annual checkup, primarily because his employer's insurance plan requires it. He feels fine. He has no complaints. When his blood work results return, I call him back in for a follow-up conversation. His estimated glomerular filtration rate, which is the measure of how well his kidneys are actually filtering blood, has come back at approximately 48%. Nearly half of his kidney function is already compromised. He is not diabetic by clinical definition. He is on no medications that would explain this finding. We sit down together and I begin asking detailed questions about his daily diet and drink consumption. Here is what emerges. Every morning he starts with a large flavored coffee drink from a chain restaurant containing between 40 and 60 grams of sugar. He has a sweetened flavored yogurt for a mid-morning snack that contains approximately 25 grams of added sugar. Throughout his workday, he drinks 2 or 3 energy drinks to maintain his energy and focus, each one containing between 27 and 35 grams of sugar, along with other compounds that add additional metabolic burden. In the evenings, he relaxes with a couple of glasses of sweet iced tea or lemonade. He sometimes has a glass of what he considers healthy orange juice in the afternoon. When we calculate the total added sugar consumption from just these habits, we arrive at somewhere between 100 and 130 grams per day, every day, for years. He had absolutely no idea, because not one of these items was something he thought of as unhealthy. Every single one was something he had been consuming since he was young. Society had normalized all of them completely. His kidneys had been silently absorbing the consequences of this intake for a decade or more, and by the time we discovered it, nearly half of their capacity was already gone. This is not an unusual case. This is representative of what I see again and again, week after week, in my clinic: the artificial sweetener trap. At this point, many of you may be thinking about switching to diet sodas or artificial sweeteners as a solution. I understand that instinct, and I want to address it directly because I think it represents one of the most common and consequential misunderstandings in the realm of dietary health. Artificial sweeteners do not cause blood sugar spikes in the same direct way that regular sugar does. On that single metric, they perform differently, but the emerging body of research on artificial sweeteners is painting an increasingly concerning picture. Several studies have demonstrated that artificial sweeteners can significantly alter the composition and function of the gut microbiome, the community of bacteria that lives in your digestive system and plays critical roles in metabolism, immune function, and inflammatory regulation. These microbiome changes appear to paradoxically promote insulin resistance and metabolic dysfunction, even in the absence of real sugar consumption. Other research has identified associations between certain artificial sweeteners and increased markers of systemic inflammation. And there are studies that have found associations between long-term heavy artificial sweetener consumption and declining kidney function, though the mechanisms are still being actively investigated. The important takeaway is this: switching from regular soda to diet soda is not the safe alternative that decades of marketing has suggested. It may trade one set of problems for another. The real goal is not to find a safer way to continue a sweet beverage habit. The real goal is to fundamentally shift the relationship with sweetness in your diet overall. The fruit juice misconception. I also want to spend a moment on fruit juice because this is a source of significant confusion and one of the places where well-intentioned people routinely cause harm to their kidneys without realizing it. Whole fruit is genuinely beneficial. Whole fruit comes packaged with fiber, vitamins, minerals, phytonutrients, and antioxidants that together slow sugar absorption, support gut health, reduce inflammation, and provide genuine nutritional value. Eating an apple is a completely different metabolic event from drinking a glass of apple juice. When you process fruit into juice, you remove the fiber and concentrate the sugar. A single 12-ounce glass of commercially produced orange juice or apple juice can contain between 25 and 36 grams of sugar, which is comparable to a can of cola. And without the fiber that would accompany the whole fruit, that sugar hits your bloodstream rapidly, driving the same blood glucose spikes and insulin responses as any other form of refined sugar. Over time, with regular daily consumption, the cumulative effect on your kidneys is functionally the same as drinking sweetened beverages. The fact that this sugar originated in a fruit does not meaningfully change how your kidneys respond to the chronic elevated blood glucose exposure. Sugar that damages the glomeruli does not ask where it came from. What you can do, starting today. I want to be very clear that I am not here to overwhelm you with guilt or to make you feel as though your kidneys are already beyond saving. The reason I explain all of this with such detail and directness is because knowledge genuinely is the foundation of change. And for most people, the changes that protect kidneys most powerfully are not radical, expensive, or complicated. They are consistent, sustainable, and absolutely within reach, starting right now. The first and most impactful step you can take today is to begin replacing sugary beverages with water. I know that seems almost too simple, but beverage consumption is the single most concentrated source of added sugar in most people's daily intake, and it is also the most replaceable. Water hydrates the kidneys, supports filtration, reduces the concentration of waste products in urine, and costs almost nothing. If plain water feels unappealing to you, add fresh lemon or lime juice, sliced cucumber, fresh mint, or a few strawberries to give it natural flavor without added sugar. Herbal teas without sweetener are also excellent. The goal is to fundamentally displace the sweetened beverages that are doing the most damage. The second step is to begin reading nutrition labels with attention specifically to the added sugars line, which is now listed separately on food labels in many countries. When you start doing this consistently, you will very quickly develop an accurate picture of where sugar is actually entering your diet. Many of the most significant sources of added sugar are products you would never suspect: pasta sauces, salad dressings, bread, flavored nuts, packaged soups, and countless others. This awareness alone changes purchasing habits significantly. The third step is to move toward whole, minimally processed foods as the foundation of your daily eating. This does not require culinary skill or expensive ingredients. It means choosing an orange over orange juice. It means making a simple salad with olive oil and lemon instead of bottled dressing. It means cooking a batch of grains or legumes rather than relying on packaged convenience foods. The more you can eat food in forms that resemble what they looked like before processing, the better your kidneys will be protected. The fourth step is to get your kidney function tested if you have not done so recently. A simple blood test that measures your creatinine level and calculates your estimated glomerular filtration rate gives you a direct, objective measure of how your kidneys are functioning right now. A urine test can detect protein in the urine, which is frequently the earliest detectable sign of kidney damage, often appearing years before any other indicator. These tests are widely available, relatively inexpensive, and could identify a problem early enough to make a genuinely meaningful difference in the long-term outcome. If you have not had your kidneys checked within the past 12 months, please make that appointment this week. This is not something to postpone. The fifth step is to monitor your blood sugar proactively, not just reactively. Ask your physician to check your fasting glucose and your hemoglobin A1C at your next visit if they are not already part of your routine panel. The A1C test provides an average of your blood sugar levels over the preceding 2 to 3 months and is one of the most powerful tools available for catching blood sugar dysregulation before it reaches the level of a formal diabetes diagnosis. If your numbers are elevated but not yet at the diabetic threshold, that information is enormously valuable. It is your window of opportunity to intervene before permanent kidney damage accumulates further. The sixth step is to be aware of the medications you take regularly, particularly over-the-counter pain relievers. Non-steroidal anti-inflammatory drugs, including ibuprofen and naproxen, are among the most common over-the-counter medications in the world, and they are also known to be directly nephrotoxic, meaning toxic to kidney tissue, particularly with regular use and particularly in people whose kidneys are already under metabolic stress. If you are taking these medications frequently, speak with your doctor about kidney-safer alternatives. Your kidneys already have enough working against them. They do not need additional chemical burden. The opportunity you have right now. I want you to sit with something for a moment. The damage that excess sugar causes to kidney tissue does not happen all at once. It accumulates gradually, quietly, and consistently over time. But here is the other side of that same principle. The healing and the protection that come from removing that source of damage also accumulate gradually, quietly, and consistently over time. Every day that you choose water over a sugary drink is a day your kidneys have less inflammatory burden to manage. Every day that you eat whole foods instead of processed sugar-laden packaged products is a day your blood glucose has less cause to spike. Every day of sustained improvement in blood sugar control is a day the glomeruli in your kidneys are spared further scarring. The kidneys are remarkably resilient organs when given the conditions to stabilize. Research has shown that in people with early to moderate chronic kidney disease who make meaningful dietary and lifestyle changes, the rate of progression can be significantly slowed, and in some cases, function can stabilize or even modestly improve. This is not wishful thinking. This is documented clinical reality, but it requires action taken while there is still meaningful function to protect. The challenge is that the urgency is invisible. Nothing hurts. Nothing feels wrong. The absence of symptoms is exactly what makes this crisis so widespread and so devastating. People are not ignoring a problem they can feel. They are simply unaware of a problem they cannot feel. And that is exactly why you watching this video and sharing it with the people in your life is so genuinely important. The patients who sit in my office in the most difficult circumstances are not there because they were reckless or indifferent to their health. They are there because nobody gave them this information while it still mattered. They consumed what they were told was normal. They followed the patterns that everyone around them followed. And their kidneys bore the cost silently for years until the evidence became impossible to ignore. You now have information that many of them never received in time. That puts you in a fundamentally different position. The question is what you choose to do with it. Your next step and a request from me. I want to ask you to do 3 things before you close this video. First, make one change today. Not tomorrow, not when you get around to it. Today. Whether that is choosing water instead of a sweetened beverage at your next meal, or throwing away the energy drinks in your refrigerator, or looking up how to book a kidney function test with your physician. One specific, concrete change that begins the shift in a better direction. Small actions taken consistently over time are what actually change outcomes. Second, drop a comment below and tell me what change you are committing to today. I read your comments, and there is real accountability in stating your intention publicly. When you write it down, you are far more likely to follow through. I also want to hear from you if you have questions or if there is a specific aspect of kidney health you would like me to cover in a future video. Your comments genuinely shape the content I create. Third, if this video gave you something valuable, please hit the subscribe button and turn on the notification bell so you never miss a new video. I put out content on kidney health, metabolic health, and practical strategies for protecting your long-term function on a regular basis. Subscribing takes 2 seconds and ensures this kind of information reaches you every time I publish something new. And please share this video with someone in your life who drinks sweetened beverages daily, someone who has not had their kidneys checked recently, someone who might benefit from hearing this while there is still time to act. You sharing this could genuinely make a life-changing difference for someone you love. I am Dr. Clarence Martin. I have been your guide through this conversation, and my deepest hope is that something in what we covered today is the thing that prompts you to take your kidney health seriously before it becomes a crisis. These organs work for you every hour of every day without asking for anything in return. The least we can do is stop feeding them the substance that is quietly destroying them and give them what they actually need to keep doing their job. Take care of yourselves. Take care of the people around you. And I will see you in the next video.